Good afternoon. Apologize for the technical difficulties. My name is Dr. Jeremy Adler. I am the Tippecanoe County Health Officer. Welcome to our local COVID-19 update. Today I'm pleased to be joined by Lafayette Mayor Tony Wazworski, County Commissioner David Byers, and Dr. Esteban Ramirez, the Chief Medical Officer for the Purdue Health Center. We'll begin, like we usually do, with a brief review of our local COVID-19 data. This first slide just reviews the 5 data points that we are following here locally excuse me, with the COVID-19. The first, of course, is our number of new confirmed COVID-19 cases. The second is our percentage of COVID-19 tests that are positive. That's also known as the percent positivity. Third is the number of COVID-19 hospitalizations, including patients in the intensive care units and on ventilators. Fourth is the number of emergency department visits for respiratory illnesses. And lastly, the number of deaths due to COVID-19 in Tippecanoe County. Currently, we have 734 active cases of COVID-19 in the county. 1,038 individuals have recovered, and we've had 13 deaths. Our cumulative number of confirmed cases is at 1,785. In the last 28 days, we've had 540 new cases. In the last 7 days, 167 new cases. Whoop. I think I exited by accident. There we go. Sorry about that. This slide shows our daily new cases of COVID-19. As you can see, the number does go up and down from day to day, but the overall trend is heading upwards in terms of our new cases by day. Another way of looking at this is by looking at the average daily number of new cases by week. And as you can see, the shape of this curve is similar, overall trending upwards with a highest number last week of 23.7 new cases per day, down a little bit so far this week with 19 per day, but the week, of course, is not over yet. This next slide summarizes our testing data for the county. The cumulative number of individuals tested has been 37,091. In the last 7 days, we've had 4,373 individuals tested. Below these numbers are our percent positivities. The first is the cumulative percent positivity of 4.8%. And then in the last 7 days, our percent positivity has been 3.8%. As a reminder, the World Health Organization goal for percent positivity is to be 5% or below. So we're looking good here in terms of percent positivity. And we are lower than Indiana as a state, and also as lower than the country as a whole. And this graph just shows the trends in our percent positivity dating back to early May. And as you can see, for 4 of the last 5 weeks, we have been below 5%. So this is very promising sign for our county. This next slide shows our local hospitalization data for COVID-19. The top line are the number of patients in our hospitals with COVID-19. The middle line is the number in the intensive care unit, and the bottom line is the number on ventilators. So each of these points is the highest peak point for each week, and fortunately, as you can see, our hospitalization numbers are decreasing for COVID-19, also a good sign for our community. And this last slide shows the number of ER visits for respiratory illnesses. We use this as an indicator of potential COVID-19 activity in the county. Our number for the past week has gone up slightly to 168 from where it was before at 123, but remains lower than some of our numbers from earlier in the summer. So to summarize, we are seeing an increasing number of new cases of COVID-19 in Tippecanoe County, so it's important that we all remain vigilant in our efforts to prevent transmission of COVID-19. We are, however, seeing a favorable percent positivity, which indicates that currently transmission is at a manageable level, but as we have seen, this could change very easily. So the key steps for all of us in our community to help keep COVID-19 under control remain the same. We need to wear our face coverings, we need to practice social distancing, and we need to wash our hands. It's especially important that we avoid crowds as much as possible, especially when those crowds are not adhering to social distancing or face covering practices. These are our best tools for this pandemic at this point, and doing these things should help keep our county moving in the right direction in terms of COVID-19. Today I'm announcing an amendment to the restaurant and bar order that was issued on August 13th. Based on feedback from area businesses, our local officials proposed modifying the order to allow establishments to offer bar top service until 9 p.m. for patrons who are dining. After careful consideration and consultation with the Board of Health, the order will be amended to include this relatively low-risk modification that we hope will help establishments increase their dining capacity. The amendment states that restaurants, bars, and nightclubs are permitted to offer bar top service until 9 p.m. for patrons who are dining, provided social distancing of 6 feet is maintained between parties seated at the bar. Tabletop service is required for patrons not seated at the bar. As in the previous order, patrons are required to remain seated. The amended order will be posted on the Health Department's website following this press conference. That concludes all my remarks for today. I'd be happy to answer any questions from the media or from Facebook Live.
This is Anna Darling from WLFI. Just wanted to know, with the restaurant mandate, Indianapolis is starting to open up their local food establishments more. Purdue's numbers or student numbers are relatively low compared to other universities. I'm just wondering why we're still being really restrictive with the restaurant mandate.
Sure, that's a great question. This pandemic has really presented unprecedented challenges for all of us, and one of the things that we're striving to do is staying one step ahead of this pandemic, and we would rather be proactive than reactive. And there's quite a bit of evidence from around the country and around the world of the increased risk of COVID-19 transmission in restaurants and bars, just inherent to that setting. And so we felt that it would be very beneficial to our community to put these measures in place now so that we can prevent a significant increase in COVID-19 and, importantly, keep our businesses open.
With that change, were there any discussions about late night hours? And as for Dr. Adler, and any other changes that might be made in that order, including places that just serve food? And also for the mayor, I know you're going to have to leave here soon. What are your thoughts on that change? You had some very specific ideas about what should happen with that health order about a week or two ago.
Sure. So to answer the first part of the question, yes, there has been some consideration to modifying the hours of operation restriction, and that's certainly still on the table. We're going to watch our local data very closely, and also our contact tracing data, and see where things go. If things do continue to look favorable, we may very well make a change to that part of the order.
I think that's what Dr. Adler said is correct. We all got together, we've looked at this, all the elected officials and the health department, and we feel this is a good first step, and a step that can be done safely, and it's certainly a step in the right direction. I can tell you that between some of us, if not all of us, people are talking literally every day between each other, watching numbers, watching the positivity rates, making sure that we have open lines of communication with Dr. Adler and the health department and the elected officials. And I think this is, that's how this came about. It was a good step. It was a good collaborative step of people working together. And as also indicated, we've talked about the hours and some other things, and we're going to continue those discussions, and we're going to continue to watch in a way to do this, to do everything we can for our local businesses and do it in a safe manner. I do think, and I could be wrong on this, Indianapolis is reopening, but they've actually been closed, and I believe they're only opening at 25%. So, you know, we're at 75%, and if we get this bar top service back in, at least till 9 o'clock, we can get through lunches and dinners and some things, and I think that is certainly a good step in the right direction, and I appreciate everybody working together to make that happen.
Thank you. Yes, and I also believe that Marion County, in addition to being at just 25%, their bar top service is not permitted there, and their establishments close at midnight also.
You talked about contact tracing in the restaurant and bar area. Has that presented itself here? Has it been a problem, not been a problem? And do you expect that to change now with this change?
So far, it's not been a big problem. We've not had any large outbreaks associated with any restaurants or bars, and that's one of the reasons for having an order like this, is to prevent that from happening. Certainly there have been scattered cases, of course, in restaurants and bars from the beginning of the pandemic, but nothing that has been at a level that would be considered an outbreak. But we'll be watching that very closely, of course.
Is the health department aware of any more outbreaks within local nursing homes?
There have been some additional cases at nursing homes, but they are in low enough numbers that they would not be considered outbreaks.
Just a technical question that comes up quite a bit from people for both Purdue and for county. How are the county's numbers and Purdue's numbers, how can we reconcile those? They come a day apart from the state. The state's always a day ahead of Purdue. Is there a way that we can kind of get a sense of how much Purdue is adding into the county's numbers, or should we just take that as a straight math? I just want to make sure that we're clear about that.
Sure. So the numbers that we present as a county are the same numbers that the State Department of Health reports. So our numbers are the aggregate of all of our cases in the county. So I think in terms, to answer your question about how to separate out Purdue from that, would be a matter of looking at the Purdue dashboard and subtracting those numbers from the total county numbers.
And I would agree. We report to the county and to the state our numbers. But again, the dashboard's going to give you the most accurate picture of what's going on.
So it is just a straight one-to-one?
Yes, and we do put a notation there as well on the bottom of our graphs that, of course, this is kind of a rolling, you know, we kind of have data constantly being put out. So we want to be fair in saying that this is preliminary data, and as time goes on, those numbers become more solidified.
This one's for Dr. Ramirez. We had seen reports that vaping has led to cases on Purdue's campus. Could you explain the situation, what's going on, what is being done to mitigate that?
Absolutely. So actually, this came about from discussions by our case managers and contact tracers. So we would ask questions, and what we ended up finding out is some students use vaping products. And through some discussion, not only with the students, but even with some parents, it became apparent that this is pretty common to share these devices. And so Purdue thought that this might be an opportunity to provide some education and be able to hopefully kind of attract attention to the fact that this is not a great time to be sharing products like that. You know, COVID is very easy to spread already on its own, and sharing devices that, you know, you're sharing saliva, it could be even more easy to spread.
Just a quick follow-up. Do you know about how many cases are connected to sharing vaping?
That's hard to say. Again, this is coming through some of the qualitative interviews, but I don't think I can really give a number to that.
Last week we talked about campus and the problems with congregate housing. Is that still the main thing that's happening? And what have you seen trend-wise in that you're attacking on campus?
Absolutely. Most of our numbers are still coming from the congregate housing area, and it has to do more with the living situations, the open spaces. And again, thankfully, this is not associated with partying. It's not associated with doing things that are unsanctioned. It's more just the everyday. It's just an open space. And to have so many people living in one area, it's easier to transmit that. The trends that we're seeing overall, I think we're starting to see a little more stability. It's still too early to say that what we're seeing on a daily basis is going to remain constant. We still see a little bit of an uptick, but I think we're starting to see a trend. And if you look at our dashboard, you see that the numbers are starting to level out at a particular percentage rate. Currently, our positivity rate is 2.92%. And if it's okay, I'll just kind of review our numbers for this week. So we were able to test 4,968. We have 137 students that tested positive, 8 employees, so for a total of 145 positives, which gave us that 2.92%. Also, our dashboard now shows our number of isolation and quarantine spaces that we have on campus. So that's a new addition that we just put out, I believe it was early this week. And so that just kind of puts in perspective how we are doing with our resources on campus. Currently, out of 884 beds total that are available, we're only using 50 beds. And we're adding actually another 56 beds to that number in the next couple weeks. So our total beds will be even higher come a week or two from now.
Also for Dr. Ramirez, I'm just really want to know what is kind of happening at Purdue, because when I look at other universities, especially Big Ten universities, like when I look at IU right now, cases are just spiking and spiking. They're like their Greek houses are on lockdown. I'm just wondering like that's happening at many universities, and I'm just wondering what's going on at Purdue that numbers are staying so low.
Sure. We've had a chance to talk to some of these universities, and we all are trying to learn from each other, what worked, what didn't work. We do have a different approach in some areas. For instance, isolation space is kind of a benefit that we have in our plan. We have almost 900 beds at this point, and we're hoping to add more. So I think isolating those individuals that are positive seems to be an important piece so far. And our quarantine process as well. If folks can't do that, what we think we can't do that safely, of course, we want to move them to a place where maybe they can have a better opportunity to stay away from others. So I think the program at Purdue just adds a few other benefits, such as that.
How many more isolation beds do you want to add? And is that just a tip to all of us that you expect to fill those?
Well, we're trying to predict, right, how this might potentially go, and that's very difficult to do. I don't think anybody can really give you a precise number, but we're, based on our calculations of what we were seeing with the county and with the state, we kind of came up with a projection that 1,000 would be a nice number to have. Hopefully we never come even remotely close to ever having to use that, but we think it's better to have that ahead of time and utilize it as we need to than to try to scrounge around and find it in the middle of a panic. So we just want to be as prepared as we can be and anticipate.
Going back to the restaurant and bar order, was there any talk about possibly zoning this in some way so other parts of the county were not covered by what is actually aimed at Purdue? Or is it still aimed at Purdue, or do you think this is a bigger issue at this point?
There was talk about trying to establish some sort of boundary or zone, and we looked at that, many people looked at that from all possible angles, and we realized that it wasn't really feasible to do that for many reasons. I think that what we know from data from around the country and around the world is that restaurants and bars are potential hotspots for COVID transmission. And so I think putting these measures into place in all of our establishments throughout the county is going to help not just the Purdue community, but also our community as a whole.
This is a kind of random question, but I've seen reports of or research coming out about vitamin D deficiency and how vitamin D plays an impact on your ability to, like your immune system and susceptibility to coronavirus. Is that something people should be aware of?
Yeah, I've heard a little bit about that. I haven't looked into it in great detail, and perhaps Dr. Ramirez has looked into it. Vitamin D is obviously an important vitamin for us in many ways, and vitamin D deficiency is not uncommon. And so just from a general health standpoint, it's a good idea for all of us to make sure we're getting enough vitamin D. If it happens to help prevent or fight coronavirus, that's even an additional added benefit.
I'll say as a past dairy farmer, everybody should drink a lot of milk, so, and that will help.
For the mayor and the commissioners, before you have to go, size up what you think you're seeing in the community in terms of, are we doing okay, need to do more? I mean, just give me a sense of what you're thinking.
Sure. I feel like the community as a whole is doing a very good job, I think, from the citizenry in general, to our businesses, to our schools, to our governments, to the health department, to the hospitals and their preparations, all that thing. I think our community is really doing well, and I think our positivity rate reflects that, and that's why we're able to make some changes that we're able to make today. But as you've heard, we know things can change quickly, so we are taking incremental steps that we feel are prudent, but we want these numbers to continue this downward trend, and we want that will allow us to continue to move our businesses forward, to help our locally owned small businesses in particular, and keep the rest of the economy moving forward. So we're encouraged by what we see. We're cautiously optimistic, but we're going to continue to have these discussions, and we just want to reiterate to folks to wear your mask, wash your hands, work on that socially distance, keep distancing, keep doing those things that are allowing us to keep these numbers in a manageable area for individuals and for the hospital. So I'm cautiously optimistic, but I do think the community as a whole has done a very good job.
And I can agree with Tony. I think there's a lot of citizens that are tired and should snap their fingers and it should all be over, but we know it's not going to be, and as long as we continue to do the proper things, the masks, the washing the hands and such, and as you look at the numbers, I think we are doing it in the right direction. I'll compliment these gentlemen, really. I mean, there's some businesses, some businesses that aren't happy because, yes, they'd like to be 100% open and things like that. But by keeping these rules and regulations going, we're holding our numbers correctly. And I think a lot of us thought once we saw 40,000 students show up, we'd see this thing turn on a dime, but it's not. So that means the students are accepting the pledge, and the community is accepting the pledges, and we're heading in the right direction.
Dr. Ramirez, with the announcement yesterday about no spring break and a new schedule for the semester, do you have a sense of whether there's going to be another round of early testing? Are the students going to have to go through the same thing? And what can the community expect from students who will be gone for 6 to 8 weeks and then come back?
Yeah, we're currently in discussions of that exact plan right now. You know, we weren't sure how the first couple weeks were going to go. Now we have a couple weeks under our belt, and so we're starting to look a little bit past our first month. So I think now we can start feeling like we can start planning for what it might look like come January or after the holidays. So I don't have an answer for you yet, but we are in discussions of that.
Also for Dr. Ramirez, just want to know how many Greek/co-op houses are infected, are any under quarantine? What's the situation with those organizations?
Sure. So based on the latest numbers, which were today's numbers, we have about 27 houses that have positives in them, and only 6 are under a larger scale quarantine. and most are actually at the near end point of that quarantine process. I believe 3 are going to be off of that quarantine process this week, with another 3, I think, coming in the week after that. At that point, then we will have no other houses that are under quarantine. And I really think there was a benefit of learning that was going on. I think people were able to, as we were giving some advice, I think that spread as well. And we're actually meeting with a couple of the co-ops and fraternity sorority leadership to make sure we convey the exact same message to everyone, not just to the ones that are already affected, but hopefully to the ones that either never will be affected, or if they are in the future, the same advice is provided and they start planning now for it. And we found that once we were able to get those different processes in place, we seem to be able to control it better.
Just want to know if there's any update on our K through 12 schools. How are they doing? Any cases, any concerns there as we've gone a few weeks into regular school under our belt as well?
Sure. So, as I mentioned during the last press briefing, there have been some cases in our local schools. We expected there to be cases in the local schools. That being said, the schools have done a wonderful job, not only in terms of their preparations and the changes they've made in the school environment, but also in the way they've handled these cases. Some of the schools have established their own dashboards that will give exact numbers. One area that we have seen as an area of concern has been positive cases on sports teams, school sports teams, just because of the nature of sports practices and events that can result in the quarantining of a large number of students, which is unfortunate, but that's just part of the reality of the COVID-19 pandemic. So we've been urging schools to really look at the way they're setting up their sports practices and looking at ways to perhaps lessen the close contact to whatever extent is possible in those settings.
Just to follow that up, is there any thought about trying to shut high school sports down for any reason?
Not from the county health department. School sports are governed by the IHSAA, and certainly we would follow whatever advice or guidance they would give on sports, on continuing with sports versus reducing sports or canceling sports. Thus far, I'm not aware that they have any plans to make any changes. That being said, of course, as a health department, we're watching our local data very closely, working closely with our schools, helping them through these situations. And, to the extent that sports affect the rest of the school, we're very much in tune with that and watching things closely. If there are no further questions, I'd like to thank everyone for attending, and we'll see you next time. Thank you.